Hi, good morning, Peter. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Peter Strauss.
And what is your candidate number, please?
My candidate number is 232481225.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Do you have a preferred shift you would like to work?
I feel like I could be comfortable working any shifts. However, as a new nurse, I would love the opportunity to work during busy shifts. I feel like this would give me the opportunity to develop and sharpen my skills. If your facility offers rotating shifts, I would be happy to experience the diversity that it offers.
How do you keep personal problems from interfering with work?
I know there are times when it is more difficult to keep personal problems from weighing on you. When something is stressing me, or I'm facing a problem, I have learned to take the time to address that issue at home, and try to resolve it. Before I go to work, I give myself a little time to focus on what I need to accomplish at work, and establish a mental game plan of how I will get things done. I find when I intentionally focus on work and set priorities, I am less likely to become distracted by other issues.
Do you have a preference of nursing specialties?
One thing I love about nursing is, there is a specialty for everyone. Eventually, I would love to work in an area that deals with cardiac critical care. I understand, I need experience before I can do that. So, if I had my choice, I think a great place to start would be the med-surg floor.
Do you have experience working in the healthcare field before becoming a nurse?
I've never had a paying job in the healthcare field, but I have done a lot of volunteer work. I have assisted with planning health fairs at local nursing homes and hospitals. I also spent 2 summers as a volunteer candy striper. Those experiences helped broaden my view about the healthcare industry, and influenced my decision to become a nurse.
What are some things you would like to improve about yourself?
I could probably think of several things I'd like to improve about myself. If I had to choose a few, I'd say, I would like to improve my ability to set personal boundaries and goals. Sometimes, I let my drive to do well at work, or for other people get in the way of accomplishing things that are important for my own growth and development. Sometimes, I have a hard time telling people no, even if it means crowding my personal schedule, or interfering with my own plans or needs. I feel like, if we all learn the importance of setting boundaries, and working toward personal achievements, we become better people, and it benefits everyone.
Great. Thank you very much for sharing that. So, let's move on to roleplay now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking roleplay. Don't worry if I stop you when the time is up.
Mihiraa, thank you for allowing me to assess you. But before proceeding with further things, I would like to ask you a couple of questions, shall I?
Yes, you may please.
Mihiraa, could you please tell me in detail about your bruising?
Sure. Well, nurse, the bruising appeared 2 days after I started taking the injections on my own.
All right, I have noted it. Now can you please tell me, have you experienced any pain in the site of discoloration?
Yes, nurse, the bruises are more painful now than when they first appeared.
I am sorry to hear you are in pain. Please be relaxed. Hopefully, we will be able to subside your pain. Besides these, do you have any other symptoms, such as fever, nausea, or shortness of breath?
No, nurse, I haven't had any other symptoms, and I feel well otherwise.
All right, good to hear that. And, may I know about your compliance with the administration of injection?
I have been able to take the injections successfully, on a regular basis, as I was told to do.
Great to know that, Mihiraa. However, I would like to give you some advice regarding the best administration technique for heparin injection, so that such conditions and further complications can be avoided.
Definitely, nurse. You may please.
I appreciate your willingness to listen. First of all, I can give you some instructions regarding the method of injection. While doing the injection, make sure you pinch the site, and then do the injection. Moreover, as you inject, slowly release the pinch. I hope it is clear to you.
Yes, actually, I do follow the same method.
All right, so continue to follow the same. The second thing to be taken care of is consistency. That is, you should be consistent with the time of injection. Along with that, you should not do injections regularly at the same site itself. Instead, please change the site of injection every day, to avoid unnecessary skin troubles.
Oh, I wasn't really aware of it. I have been using the same area for the injection on my skin. I really forgot, it had to be different.
No worries, but from next time onwards, please remember to change the site of injection, as it can reduce the risk of trauma to the skin. Hence, less risk of bruising and pain.
All right, nurse. I will follow as you suggest.
Thank you for accepting my suggestions. Now, Mihiraa, the next thing you can do to prevent further bruising is to give pressure if the injection site bleeds, and remember to avoid rubbing the injection site after the prick.
I understand what you are saying. Actually, nurse, I think it's better if I can just stop having the heparin injections.
I realize what you are saying. Perhaps it is very important to continue injections, as your activity level is insufficient and there are ongoing risks of blood clots. Therefore, to prevent all these complications, it is better to continue the injection, as per the doctor's advice.
What you are saying is correct. But I don't really think I need them. Nurse, you should understand that now I am able to get up and move around my house a bit more. So, do I really need to continue taking the injection?
Mihiraa, your thoughts are quite natural. By the way, at this point, the level of activity will not be the same as your normal regular level before. So the injection needs to be continuously taken for a short term, exactly speaking, as per the doctor's instruction of 30 days after the surgery. Currently, you have already finished a week from that.
Okay. As of now, please tell me, I would like to know, what can be done about the bruising I have.
At present, there is no need for any treatment for bruising, as it is all self-resolving. There is no room for further concern.
All right, nurse. I got it.
Great, Mihiraa. Now, for the time being, I suggest you just continue your injection until the next doctor's appointment.
All right, nurse. I will continue taking the injections on my own, until I see the doctor.
Thank you, Mihiraa, for understanding and accepting my suggestions. I wish you a healthy life ahead.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.